younger than the age of 40, what we will definitely advise you to do, and it's all around the world, the protocol once you've been diagnosed with keratoconus, is to do a procedure that we refer to as cross-linking. Because what happens as your cornea protrudes like this, in a young person, your tissue is quite, how can I say, almost pliable, flexible, and it can then gradually get worse. So your cone just becomes more cone-shaped and cone-shaped, and your cornea in that area becomes thinner and thinner. And we want to stop the progression. We want to strengthen your corneal tissue in order to stop the progression. What does corneal cross-linking entails? It's a procedure that doctor does at the Life Peninsula Eye Hospital or eye clinic, and it's not a surgical procedure as such. It takes place in a day clinic. Doctor will soak your eye with vitamin B. He'll take the first layer of cells of your cornea off again in order for the vitamin B to really get into your eye, and then he'll tan the cornea. He'll expose the cornea to a UV light, and the UV light will stiffen the tissue of your cornea. This procedure, and this must be very clearly understood, this procedure is not to make your vision better. It's to stop the progression of the condition that's called keratoconus. Once you are older than the age of 40, your tissue is much stiffer. So the chance that you will progress from there onwards is unlikely. So we advise you to definitely, as soon as possible, as soon as you are diagnosed with it, to do the corneal cross-linking procedure. Also, once you've been diagnosed with it, it's advisable for you to, if you have children, to check them as well. Or if you have a brother or a sister, or if one of your children has been diagnosed, check the brothers and sisters as well, because it is hereditary. What we will do straight after the corneal cross-linking, again, doctor will put a bandage contact lens on, because he removed the outer layers, the first layer of cells from your cornea, and if we are not going to put a contact lens on or something to protect, you'll be extremely scratchy and you won't be able to blink your eyes. So we put the contact lens on so that in order for you to be able to blink with less discomfort. Now it is, we ask you to use again antibiotic drop, anti-inflammatory drop, lubricant. First few days after corneal cross-linking, it is quite scratchy, so you can expect that. If you're in school, you need to be able to take a few days off. If you're at work, you need to be able to take a few days off. 5 days later, when you come and see us for a follow-up, doctor will make sure that the cells of the cornea has formed completely towards the center, so that the whole area has regenerated. Then we can remove the contact lens. Again, just be clear, it's not, you don't expect your vision to be better. We're just trying to stop the progression. A week or two later, when you feel comfortable, that's when you test yourself or get fitted with a hard contact lens or a scleral contact lens for you to get the best optical quality. What we will advise, 6 to 9 months later, we want to repeat the scan of your eye, of the topography of your eye, to make sure that it is not getting thinner and it actually did stop the progression of the thinness of your cornea.